Hello everyone, I'm Zaki Haider, Director of Innovation at Empower Social Enterprises. I'll be helping moderate this session. So welcome to our third webinar on e-learning. Today we have a different setup than what you are used to. We have a lot of people with us today, and we have a different set of panelists that you can see here. To begin with, I would like to introduce our chairman of this session, Dr. A.M. Zakir Hussain. Dr. Zakir sir is a CEO of Social Sector Management Foundation. He was also the former director of Primary Healthcare Division, Director General of Health Services in Ministry of Health and Family Welfare in Health in Bangladesh to improve access to health services. We have with us as our keynote speaker, Dr. Bruce Dahlman, Director at Digital African Health Library. He is also an advisor to the Ministry of Health in UK. As an esteemed keynote speaker, he would be joining us from he's in UK right now, Bruce? Yes, he is. Okay. So he's closely working with African countries to use ICT for capacity and skill set development of the healthcare providers. With us, we also have Kanta Devi. Kantapa is Social and Behavior Change Communication Advisor at Plan International in Bangladesh. She is currently closely working with the development partners and the government to improve health seeking and lifestyle management behaviors of general population. She is also connected with our SBCC Council. We also have with us Dr. Nazmus Sahar Sadiq. We know her as Naimapa. Naimapa is the head of Health and Nutrition Program at BRAC International. She is leading health programs in different countries to improve health outcomes of the people. In those different countries include some in Africa. With me, I also have Saika Siraj, Country Director of Nutrition International in Bangladesh. Saika is currently just have joined Nutrition International. Congratulations. She's closely working with the GOB to improve nutritional status for strengthening monitoring system, awareness development, and policy development. So with that, I'd also like to introduce our audience here. We have unlike any other webinar that you usually see, we have a physical audience here as well. Here we have representatives of different government, public and private sector organizations. We have representatives from different development sector partners. And here together, we will be talking about how in the health sector, e-learning and digitization of different kind of capacity development, SBCC, different kind of trainings can help. And in the digital, what are the pain points there are? What are the new innovations that you are working in? And I would actually like to introduce our guests from maybe the left. Please. So your name and your organization would be good. Thank you.
Hello everyone, this is Sajid from WHS.
From? Hi, I'm Nurullah from Waterway Bangladesh. I'm with the advisor.
Hello everyone, this is Sundarshan Yopani. I work with Handicap International United as technical coordinator.
Hello everyone, I'm Habiba Khanum. I'm working with Democracy International.
Good afternoon, I'm Anand Koru from Web Foundation.
Hi, I'm Dr. working in the inbound health cell.
I work at Google Alliance for Improved Nutrition and Programs. Hello everyone, my name is Nathar Beta. I work as data analyst in Bangladesh.
Good afternoon. I'm Sarah Manu. I'm Chief Executive of Family and Community Empowerment Support Places, where I work for the disabled and underprivileged people. Thank
this is Ethan. I'm representing Empower and C.
Hi, this is Hassan Islam. I'm working with Care Bangladesh. Hello everyone, this is Sophie Islam from Blast.
Hi everyone, I am Ashraful. Hi, everyone.
Assalamualaikum. Warahmatullahi wabarakatuh.
Hi, my name is Steph.
Representing Sajid. Good afternoon, everybody. I'm Dr. Anshu Kushil. I'm with FHH System Bangladesh.
Good afternoon, I'm Nagin Sharafuddin, working with
Good afternoon. This is Behnuma Akhtar from Business World of Bangladesh.
Good afternoon, I'm Khalidul Rahman, working with Hasipur, System of Bangladesh as a senior.
And also the people. Oh,
Shami Hussain, United Purpose.
and also the people from Empower. We have a team here, a huge team of videographers and project managers. Cool. So let me, because we have a very short time period and a lot of things to cover. So we will be starting with the keynote speech of Dr. Bruce Dahlman, and I would ask Dr. A.M. Zakir Said to formally start this session. So.
Well, first of all, let me thank Empower for finding me and giving me this honorous job of chairing this event. I'm one of the novices, in fact, in this area. I managed program, but when we were in government job, IT sector was not that much developed as you find right now in the health sector. But still, I find it interesting to participate in this event and I get acquainted to what has been developed so far and what we have on our mind about our future. So I have come here as a learner and expecting to get more from you, from the participants, from you, and of course from all these learned speakers here. Thank you very much again for choosing me.
Like I for myself already drawing similarities with the cases that we are seeing in Bangladesh, and many of these things, many of these challenges that you are facing in Kenya, and the things that you have solved, the innovations that you have brought in, looks very familiar to the one that we are working with. So I'm sure that all the different organizations. Can everyone hear me? Okay, so so all the different organizations that are here and they are working here, I'm sure that you also have experiences to share with us regarding this, and we will actually come back to you with maybe some specific questions, or if you have some interesting comments or ideas to share, please raise voices, and there are representatives of us around you. Please write down the question and give it to them. Please also mention your organization and your name. So before we go to the next webinar, there are move of the network is so to make an individual if digital principles is
patience. From recapitulation, let me point um, on and he had uh, uh, purposely no and uh, and then these are district level, and also it is open platform. Whoever has the access can see. But then the quality of the entries, quality of information, there has been some development lingers on how we can improve quality of data that is entered. Sort of encourage our managers to use evidence. Because if planning and policy making, then the quality of evidence will improve. Quality of information. They feel that there's whatever they're entering into and that validity. So this is how we can solve that. Said one thing very, I would say, it was a learning point to me at the back of know that advertising raises, but then one-to-one in healthcare services, recent promoters, for example, they come in and try to upon and so address obviously donor fund now in the what do you call it? Whatever you have started leaders. And let's start.
Thank you. Plan, controls, sector, and the lesson from an insider's perspective. Some lights on her experience.
Being a health profession that Dr. Bruce mainly focused on in his keynote, mainly on digital or inside rather than and was health nutrition and health service seeking behavior change. So back in, I will go back to 2010 when under a USAID supported project, I was working to develop Government Ministry of Health and Family Welfare's communication capacity strengthening project. So during need assessment, it came out that, well, we knew it, but it systematically at that time, it came out that government has its like around 60,000 field workers all around the country who go to door to door at the community level in rural Bangladesh and work awareness on and change their behavior in terms of family planning method use, in terms of enhanced nutritional lifestyle, in terms of other health aspect, and also to health services which are available and provided by the government. But unfortunately, and obviously, all these 60,000 health workers did not have all the latest updated information in their hand. It was not possible because organization, government, non-government, private organization, development partners even develop plenty of communication materials. And we found that sometimes there are messages in these materials. Sometimes one material reached out to certain field workers, and within 2 years this policy. But then the latest, it was kind of impossible field workers within very short time. So basic information which were technically wrong or inconsistent. So on that kind of solutions, how we can utilize the strength of ICT solution, and we came out the idea of nutrition toolkit. So with technical expert, health and family welfare policy makers, and from the government and other sectors were involved throughout health, population, nutrition, toolkit were in this relevant field were collected, headed by the technical toolkit was developed communication material was good, not good enough. To door-to-door counseling session, they conduct courtier. They need to have the skill of motivating people. This is a sort of training. So how do you bring 60,000 people to understand the amount of resource in terms of time, financial and other logistics is required. So at that context, we developed small e-learning courses in local language, which is Bangla. So it's like self-learning. So we, after vetting, pre-testing, field testing of everything, we loaded this material in netbook and we piloted in different sub-district level in Bangladesh under the supervision of Ministry of Health and Family Welfare. So what we found was we were at the beginning, we were thinking that giving out technology to the, because field workers are not of age than some of the projects. So we were skeptic that how they will accept the technology. For sure, we provided them how to use the e-toolkit during their regular counseling. After that, they accepted it very because it helped them to do their job in a much better way. Because when earlier they were going to door, organizing counseling sessions with people, we know human listening capacity, comprehension level. We all of us, we know that how people can retention information better. All the signs we are aware of. So the government field workers would only talk and other people would listen. And now that these field workers have the netbook, they could show the material, the pictorial materials, most importantly, the short videos, short drama with very funny skits that in a subtle way disseminate educational messages. So these would the community people who are attending the counseling sessions. So it became easier for the field worker to disseminate the messages they wanted to disseminate. They wanted to spread among the community people. So it helped them. They found food, they found it effective. So, but it's not the way I'm saying it was not that easy. It involved a lot of resources, planning, resource in terms of time, resource, finance, monitoring of the whole process, and involvement of the policy from the top ministry level, top level people, policy makers to the grassroots level planners, policy makers, involvement throughout the whole process. And the buy-in is important very, because for technology, for any sort of change, we know that buy-in is very important. Unless you have the buy-in, you have the ownership, you can't make bring in any effective change. So for the troubleshooting, we employed at every upazila we had to monitoring, technical monitoring officials for closely monitoring for troubleshooting during the pilot period. And also with the project professional, we would every month we would conduct FGDs to collect information. We would conduct in-depth interviews with the health field workers who are using those tablets, e-toolkits. So we would try to find out their experiences, good or bad, whatever their experiences through HGDs in all this process, systematic research process. We found these things that there were a lot of challenges, but still this effective, they found it easy to handle. So what is learned from there is that if you have proper and proper digital solution, you need to have support from the top level to the grassroots level. You need to also have the situation analysis of this, that what could be your challenges. So we thought that even if we are giving orientation to the field workers, they still will have some sort of technical problem in using the software. They do not have to handle any software. Like the e-toolkit itself, the e-learning courses, and managing those things, managing the device itself, all these things. So that's why we recruited to monitoring officials at all the sub-district level. But the problem is that after that, scaling up was a huge problem. So how we resolve that? That hasn't been resolved. If I say in one sentence, that hasn't been resolved yet, but in the process. Because later, since this work, since the government has the digital Bangladesh agenda, which gave us a huge this policy environment. What we did, we conducted like very intensive advocacy with the government Ministry of Health and Family Welfare, entire process with the government system. And Akir just mentioned that government already has introduced tablets for collecting real-time monitoring data for their service at the field level. So we propose that why don't we integrate these two things? You are already collecting, using the tablets, you are already collecting your service delivery data. So why don't you also up this software to the same tablet so that they can use the device that you are giving to the field worker for both the purposes. They can entry real-time service delivery data at the same time for client counseling and also for their self-learning, like e-learning courses. So that process is now going on, but it's not happening throughout the whole country at a time. We all can understand that this is going slow, and still with the back push from a donor-supported project. So this is, as Dr. Bruce mentioned, that sustainability of digital project is still, I mean, like in Africa, it's because you need to push government, you need someone, a project or some sort of like push from the back is always required to enhance the government sustaining courses and e-toolkit. But do we have time? Do I have time more to talk more about other?
Well, I think we can also come back later on.
Okay,
if we have more
thank you.
time. We can.
So yeah, I will stop here then.
Thank you. Thank you, Kantadi. It was really interesting because Kantadi was talking about a journey through the problem that she was facing and how each of the solutions or innovations that they were bringing was also indicating bringing into their path some other challenges that they have not foreseen before, and then they were overcoming those challenges. And that's how the innovation journey works, because you cannot really foresee all the whole thing at one go. But what is interesting is because now we are learning from their experiences, and now we are in a platform to share it with each other. Maybe we can actually learn from the different experiences that we have seen in the past, and learn from each other and not make the same mistakes, do make the same innovations, bring in the same kind of energy and optimism into the game. So one thing that we have seen, and there are a lot of audience on the webinar as well. Over the last 3 webinars, we have actually reached out to around 30 online right now, and they are also sending in questions. So I would like to put forward one question, and I'm sure that some of these. So Dr. Charles Chengo from Zambia has asked that the challenges I see: infrastructure, high poverty levels, lack of standardization, lack of ownership of e-health, programs not coordinated and are involved in project initiation, and scarcity of health informatics specialists. Kind of challenges we are also facing in Bangladesh have so I think when we are talking about our experiences, if we keep this in, Charles Chengo would also be helped through our discussions. So keeping that in mind, I would like to go to Dr. Nazmul Sahar Sadiq, Naimapa, Head of Health and Nutrition Program at BRAC International. She's leading health programs in different countries to improve health outcomes of the people in African countries, and how BRAC is, what kind of things BRAC is doing there, and what lessons that you have learned from there.
Thank you very much. Since I'm a Bangladeshi, for a Bangladeshi, the story always starts from Bangladesh. So basically, I started working in ICT from 2003 when I was working at UNDP. And we started the project in the Prime Minister's office, and we started the digitalization of all the government formats, which later metamorphosized into the A2I project, the
access to information.
Yeah.
Yeah.
About that day today. So we have come a long way. So that my journey started from there. But recently, I started. We looked at the programs that we are doing in Africa. BRAC Internationalist digitalized program in health is in Uganda. So basically, I'd like to say a little bit about the way we work and how it is digitalized there. So basically, through the community health promoters, we care, maternal care, information to the communities about to provide treatment through the CHPs to children who have diarrhea, pneumonia, and malaria. It allows the CHPs to provide antibiotics, do malaria tests, and provide medicines, because it's so widespread they cannot do without it. So the level of services goes down into the community. So basically what the CHPs are doing is providing information, providing preventive information as well as treatments. And they also have the model where they sell medical products which is a supplement to their income. So they're not totally dependent on donor funding. So they are people who have semi-enterprises. And when the funding becomes low, then those model for the CHPs, we cover all 72 out of the 90 districts of Uganda, where we have the CHPs who provide these services, utilization of their services. So apps were provided to them, trainings were provided, they could collect the data, and each of the services that they provide has algorithm which helps them. Once they have been trained, they know that for a mother who is pregnant, what questions she has to ask. So she does not miss those issues because this helps her, because she's looking after several diseases, and it's very possible that she may forget to ask a very relevant question. So the app helps her to go through all the steps and make sure that she has asked all the relevant questions, and will be able to continue the follow-up of the client and make sure that if there are any danger signs or anything that need to be immediately taken care of, she needs to follow up with that client and make referrals. So this program helps them to do some of these things very easily and help them to continue the services that they do. For the manager, it's very easy because they can collect the data offline, but when they come online, the manager can see how many of the clients that the service provider was supposed to provide has already happened, or there were some problems, and if there are problems, then they can have a conversation with their staff to find out what was the issue that made it difficult for them to. One of the things that has been a problem in the sense that we didn't try to use the tablet. It's much more expensive than the general mobile services that we have. And it's just an Android on which the application can be uploaded very quickly. But some of the problems is that we have continued to increase the number of services that we do. Like now we are introducing tuberculosis, now we are introducing nutrition. So then for each time there is a cost for the app to be upgraded, service provider to be given. So this is an additional cost. And as Zappa said, if you have a good plan, if you are basing your whole entire services on the essential services package of that country, you can upload all of those things at one time. But unfortunately, increase is an incremental cost both in upgrading the technology, upgrading the training of the staff, and making. In Africa, one of the challenges that are there is big network strength. The country does not have enough networks. So it's like in the northern and the eastern part of the country, charging of those mobiles are very difficult. And the data comes off the service providers to handle those mobiles is also difficult because we are going through an algorithm. Often they forget. So there are several rounds of trainings that have to be done so that they can follow up. Another technical thing which I don't understand. It is difficult. So, and the other thing that we have learned through our experience is that e-learning is not a culture of the South. We like to get to see our teachers. We like to ask them questions. We like to clarify. So it costs much more if you have to have interactive sessions. So some of these challenges are, I think, very much common in almost all the countries that we are doing. That for management has become very good is that they can see the dashboard. They can kind of look at what are the trends and make decisions. Though this is still missing, which we are trying to make a culture, because getting large number of data and not doing anything with it really, it's purposeless then. It's just getting data for data's sake. one of the difficult things, issues that are there is that referrals are difficult to ensure because the field level work is being done by an NGO and facility work is done by another organization. And even if it's a government organization, getting the facility level staff to give a feedback of what they have done for the referrals is very hard. There are often excuses that we were too busy, so we could not provide that information. So this complete cycle of referrals is not happening all the time, though the practice is started, but it's not happening as yet. And one of the issues that I think to a certain extent we have been able to work out is the sustainability issue. The government, to help the government, institutionalize the system of getting the data online, using the data. So what further people and all over Uganda. So that whole process has started, and we have, because we want to have better planning for the next phase, really, and make sure that the need to be upgraded very soon. I mean, there is no system which really does not need any more upgradation, but at least for some time that you don't need any upgradation. And one of the points that we realized is that enough for building the capacity of the staff, then how can we integrate mentoring and coaching within this process so that they can reach out to people who know specific cases where they're getting stuck, how to get advice and how to get use that. So those are still in the working, that how this will be integrated into this service. So at this point, I think we have been able to do some improvement on the work that we have done. And as I mentioned when I was talking to the other panelists, that almost all donors are not insisting that within the program designs, you not only automation, but how you're going to increase the capacity of the staff regularly, and whether you're inbuilding those kind of programs. Yeah. And one other thing that is include the guidelines and the government come far off to get trainings or refresher training. And in terms of distances, Africa is very large. It's almost very to a certain place to get that training. So I'll wait.
So thank you so much, Naima. Summary. What Naima, the experience is about and a journey of from the very moment that you are collecting this data for the organization for operational management and all those data can actually feed into the system, and from those data we can create an e-learning solution which is much more customized and personalized for the need of the how you can integrate the refreshers or the capacity development and the refreshers of all the field workers. You're also talking about synchronization of those data so that after a point, if there is a referral happening, what happens to the field level, how the information from the household level informs the decisions in the facility level, and how all these together work so that the information provided to the beneficiary is much more useful to the beneficiary and also to the field workers. You're also talking about certain dashboards or information that the managers can see, which would help the whole, like from the policy level to the manager to the even field worker, him or herself, to make better decisions on the ground. Mentioned a little bit is how the experience and the way we work in the South, in global South, that we are more prone to go up close and personal, and that's the way we want to learn things, and not through an e-learning app or so. And in Bangladesh, we have seen about the co-cheered session. I personally have recently been working in Zambia. There I have seen also the same kind of idea, that they go to the household and they talk with people and there. So do you think that techno up close and personal sessions so that they can provide better e-learning solution, better solution at the end using the technology?
I'm sure they can, but that needs to be more interactive, and which is much more costly. So then we at how we bring that into the system.
Okay.
Otherwise, it becomes then it's always just things that you have put up front, and they're just listening to it, and they may have questions which we have not thought about.
Okay.
In this kind of context, that if you like, I just shared my one segment of experience with the field workers, because that made their life easier. Around the same period, we also developed program managers and program planners, that as program implementers, we know that when we design something, we need a lot of reference materials here in our hand. So keeping those things in mind, we designed the similar e-toolkit for program managers and program planners as well. But that didn't work.
Okay.
That was not successful, because that was, even if that was for the literate, highly literate population, but that was not that useful. And so the reason is, one of the reasons is, in global South, we people are not much yet, still it's improving in Bangladesh, but not still that much useful with like internet-based learning, with like passive learning, with self-learning, self capacity building. We are not that much. So we need to have some sort of like face-to-face conversation to address this kind of like situation, this kind of like challenges. What we did for field workers and also for the government planners and also decision makers, that we would organize periodically face-to-face sessions, orientations to fill in the gaps, and then again over and over you integrate the face-to-face trainings and workshops and orientations. So that kind of stuff.
So that actually brings up country director of Nutrition International in Bangladesh. She is currently closely working with the strengthening monitoring system, awareness and development, and policy development. So, Saika, if you can experience in Nutrition International and the work you have been before that, how do you like? Let's talk about that. We have to take talk about, and the way Lama has said that you have to think about the project is ending or while it is running. Like, how do you make sure that your investment is sustainable? So, if you can shed some light on that.
Nutrition International actually works for transforming lives of vulnerable people, especially the women, children, and adolescent girls, by improving their nutritional status for all kind of improvement. One is coverage, which means that you have to implement low cost, actually a lot of the second that be so opportunities or is to the more people you gather together to act, so then find out as many platforms as available. That is one from government and many agencies are trying to actually therefore part of an organization to develop some forward very beneficial if you think of co-creation of things, very similar interest. Good. And like talk to you going so that way how to be we can twist a little bit, we can
is that human resources have good is all at and to work. So we to have to they talking and uh, so would feel to the if there is not another mechanism to receive the feedbacks, right? So even within the e-tool or a digital learning tool, whatever we are providing, there should be a way to get feedback from the field because field testing can be done in a smaller community, a small case, right? But when it goes to the entire country, there might be different kind of problems identified, gaps identified. So at some point, we have to also gather those, and when we're upgrading or improving, we have to address those in that version. Also, because we're already investing so much in developing this tool, we also have to think how data from this tool can be fed back into either government systems or MI systems of the program, where DHS2 for Bangladesh, of course. So only then what will happen is that it will have a dual purpose, and the health worker will actually feel that using this is reducing my work to the that is a matter. Forgotten. In and if we the two Bangladesh.
Converse
We is with the this is
Actually, e-learning is one of the big from the previous. Learning is always good, right? Learning, but also and you have to learn. It's very not really learning. It's also
um, help the having another
course.
Speaking actually, it's really difficult to treat. So when we start this time, the people to retain. So and then the like I saw the take it as a delicacy. It is often ignored or protected. Now, that a field workers are working is already from the government side, we are arranging trainings like this programs. To help empower the doctors, veterinarians, how to use the digital today. Because looks like very complex device. This is data. It's only all the data. Yes. Already you have been contacting the team from this. How does it? Because you must
still there are huge level. I'm not talking about the micro level or at the field level, even big picture level, which came out already, that still service sporadic, unplanned, very compartmentalized, and like silo approaches. So that having two parallel system, one is digital based and another one the we all because this some is required and training orientation in terms of they need much more than that, which is to change technology and the kind of fear, quote unquote fear, of like myths, fear, misconceptions, that kind of thing. Policy level, when we still work with some of the high level policy makers have that kind of conception that they think that information leakage. If we use a digital system, some people still think that with this digital system they may lose job. They may lose like some sort of like their hierarchical positions, kind of like misconception, myths, and the kind of fear people have that needs to be removed, eliminated through different kind of orientation, trainings, and strong leadership is also required. And with this silo or digital technology system, lot of tools already we have developed in Bangladesh, in a small country like Bangladesh. So this needs to be, we talked about this, but this again I am emphasizing on it that this needs to be audience specific, issue specific, user friendly, interesting, and why people would use it. They need to have specific incentive to use that.
It's already 6.
Yes. So these are, sorry, I'm taking too much time. And decision needs to be data driven. Only people will be serious about inserting and compiling really correct data when they will see that the decisions are being made based on that particular data.
Thank you.
These are not just hypothetical work.
So one thing what Kanta was saying resonates, because the next question I'm asking is to one of our partners here, Handicap International. You'd be the right people to talk about how can e-learning be made effective for people with disabilities. Any insights that you can share with us? We have with us.
Thank you so much for the opportunity. It's really insightful to hear from distinguished people, and we've been actually designing and implementing e-learning solutions. As Handicap International Humanity and Inclusion is concerned, we've actually been trying to adopt, and one of the things that have been missed out, I would say, in a lot of discussions is the accessibility features. Who are we designing all these solutions for? Are we already including people with disabilities?
No.
Are we including people with visible and invisible types of disabilities? Who are we designing it for? As we know, data and evidences have shown that around 10% people with disabilities live and they are engaged in different kind of activities. So whatever solutions that we are proposing, that we really need to ensure and embed accessibility features into it. So one of the simple ways to do it without further complicating the issue is that, for example, when we are designing e-learning solutions, if we can have user-centric approach, meaning to say that you just consult a person with visual impairment and hearing impairment and with intellectual disabilities and get it across, or are they struggling? If they're struggling, just we need to reinvent or redesigning the whole thing. And that shows that, okay, our solution or our designing is having some impact if they get it well. And then we can say that, okay, there is a better speculation that it might work for others. So it's as simple as that. We need to work on the font, we need to work on the sign language, have a little bit of auditory when making things interesting. Also try to add more diversity. Who are we ensuring? Like, do we include people with disabilities and their PHS in the videos? I mean, that can have a huge impact on their families. So we're not talking about only people with disabilities, because we live in a world where disability is already a diversity. It's no more a thing to talk, so to speak. So this is like over the years, and it is also one of the priorities of the government of Bangladesh. So we actually have been blessed that government has a huge priority on those issues. So when digital Bangladesh is the priority, ensuring accessibility is also another priority. So we can really make these things happen if we have our mindset into that.
One thing, thank you so much, Sudarshan. One thing I would like to tell to the whole audience that the webinar is coming to an end, because it's we have a 10 question answer session can go on, and we would actually take this question answer and send it to the all the participants on the webinar as well. Like the online presentation will end in a minute or so. So thank you so much for all the people who all over the world were here with us listening in. Thank you so much. Any of the information that you need from this panel, do ask us in the webinar website, and we will provide the answers to you. And any resources that we might get shared here, we will also provide that to you. Thank you so much to everyone from all around the world. Can we have a big round of applause for everyone who has been listening?